Good morning, everybody. Nikki Burnett here. Today is Taste Like Nutrition Radio and podcast streaming live on KUHSdenver.com, where we've got Dr. Jeff Gross hanging out with us today. I am super excited about this because when we're talking about cutting edge healthcare, and not even healthcare, it's like cutting edge wellness. How is it that we can actually be our best, do our best, get beyond some of the chronic conditions that many of us struggle with? What can we do that is supportive and not going to actually stop potentially the process of healing, right? So this is all the good stuff that we want to talk about today. Dr. Jeff, thanks so much for being here. I appreciate it so much.
It's my pleasure and honor. Thanks for having me.
Yeah, it's going to be a good talk. As always, though, we start the show with gratitude. Gratitude can change the world. I think that a lot of us feel like there's some heaviness going on, and I think that's part of life. But if we live in gratitude, there's so many beautiful things to be grateful for. And I know I am every day, even when things get rough. So, Jeff, what are you grateful for?
I have gratitude for my patients. I would not be doing what I'm doing with the kind of joy and childlike interest that I still have if it weren't for them. They're the ones that suggested I go into stem cell medicine.
Yeah.
Look into it, and then it's changed my whole course in my career, and every day. And maybe it's something I'm wired to be, but I love to help people find alternatives. Mm-hmm. Provide that alternative to maybe what they're getting somewhere else in the sick care system. It's not a healthcare system; it's a sick care system.
Yep.
So I want to be that alternative, that healthcare.
Yeah, I love that so much. I have that in my bio, and I can't remember exactly what it is, but it's something about being an advocate against sick care. And this is about wellness, this is about health, this is about optimization. And if you're struggling, this is about getting beyond that, finding who can help you, because it's the body telling us there's something up, we got to figure out what's going on. I'm a full believer in partnering with our body instead of thinking that it's working against us. So I love all this amazing regenerative health wellness system that is really starting to come up. It's super exciting stuff. So I think for myself, I'm grateful for, I don't know. I think that I have to kind of piggyback a little bit. I think that being in I've been in a situation for a while where I've been working with patients who, under a clinician, with patients who are critically, chronically sick, right? I mean, it's this really hard place to be. And the stories that I hear are stories that are just beyond my comprehension, right? It's really hard for people to struggle with. And you hold on to that. You hold on to that. There's fear and there's frustration and there's my body's fighting me. Why is my body fighting me? What's going on? Why can't anybody help me? Why do my doctors tell me I'm great and my labs are fine and I feel terrible? It goes on and on. And so I think I'm grateful for having the opportunity to work with some of these people who have taught me so much more about what it is to have these frustrations. I had that in my own practice, right? But this just really is taking it to a different level. And what is it that it's made me a better practitioner? It's made me research more and study more and look outside the box more, which I'm pretty much outside the box anyway. But I'm so grateful for those people. And then I said on the promo earlier, I don't know if you heard it, but I love people with big brains, so being able to talk to you and learn from you and being surrounded, that's why I love conferences, right? People are just have these massive brains and I just want to eat it all up. So those are the things that I'm super grateful for today. So here we go. Yeah, it's going to be super fun. Okay. So let's do this. Let's talk a little bit about, so you kind of said, it was your patients who brought you to this point. I think that people have, at this point, have heard the term stem cells, have a little bit of an understanding of what it is. Maybe some people have a much deeper understanding of what it is, how they work, but then I think that exosomes is still pretty new. As far as being out, in the world of regenerative medicine and what it means and how it works and what it does and who it helps and all of the questions. So maybe if you want to dig into a little more to how you got to this point, that's great. If you just want to dig into, what you're doing and all about the exosomes and stem cells, let's just do it.
Yeah, thank you for that. I think the transition, the journeys might be interesting. So I'm traditionally trained. I'm a spine fellowship trained neurological surgeon, brain and spine surgeon. I focused on the spine for the vast majority of my career, board certified, recertified 10 years later. And I looked back and I was always trying to push the envelope on new things. But I noticed that all my colleagues, even the younger colleagues, weren't doing anything new. And if you look back at the history of spine surgery as an example, and this crosses over into other specialties, we're not doing anything differently than we were doing in 1950. Yes, there's a new approach, a new incision, maybe it's a little smaller incision, maybe it's a new piece of hardware or a new widget. It's the same thing we're doing. So that was frustrating for me and my patients. My patients would say, yeah, I don't want surgery. And I'd say, great, because I don't want to do it for you unless you absolutely have to have it. And most of them didn't. And in the advent of MRI, since the mid 80s, we can find things earlier before people are unable to walk. So we've got these patients who are affected, hurting, but they can still function. They're not really ready for surgery a lot of the time. And they would come to me and say, how about lasers? How about crystals? How about stem cells? And chance favors the prepared mind. And I do have undergraduate background in cell biology, which is sort of the field of stem cells. And I said, at some point it just kind of, you hear it enough times, it kind of hits you on the head, and you know what? I'm tired of going to all these annual neurosurgery conferences where the same bow tie wearing guys are patting themselves on the back for doing the same crap year after year after year, repeating the same research. I mean, it was actually disgusting. So I said, you know what? I'm tired of that. I kind of renounced that because it was not moving forward in science and in medicine. It was part of this, incestuous system fostered by big health insurance and government policy that was driven by, big health insurance lobbyists and big pharma lobbyists and big hardware lobbyists. So I started going to stem cell conferences and re-educating, retraining, and a lot of things had changed in the 30 plus years since I was an undergraduate. And I said, wow, I learned that quite a bit of the clinical science that backs this up comes from Europe and Asia. And we were just, head in the sand here in the US. We just weren't really doing it. And if you think about it, you probably heard about, professional athletes 20 years ago leaving the country to go get stem cells, right? Peyton Manning and Tiger Woods and other. Well, why were they doing that? Well, because it wasn't robustly available here in the US. It is now, and hopefully I'm part of that, but others too. We are suppressed. We cannot advertise on Google or Facebook.
It's amazing.
They will not let us use words like stem cells, exosomes, anti-aging, longevity, any of that
who wants
stuff.
To be optimal? I don't know. Everybody just wants to get better. Who wants to be optimal? Anyway, sorry.
No, the business model is to be sick, right? The powers that be want us to be sick because it's profitable for big companies, right? So a lot of people have risen up and said, no, this is not good. I want alternatives. And I have flocked to integrative doctors, functional doctors, naturopathic doctors, and I wish I had more of that education, and I'm slowly gaining it. But I jumped into stem cells to offer it as a tool for some of my spine patients, but now it's all I do. And within 7 years, it became a sort of overhaul of my practice, my approach. And people find me that have an appetite for peptides and stem cells and exosomes, which we'll talk about shortly. And that's what I do joints, we do spine, we do IV wellness. We have some cosmetic things, face and thinning hair. We have sexual function shots for men and women. We have topical things. We have all kinds of applications, and there are new ones all the time and it's all based on medical science. What I'm saying here is not me shooting from the hip. It's based on good publications, good research that is available, just largely disregarded by the powers that be here in the U.S.
Well, it's this amazing situation that I just don't understand. I think that people who love science, right? You come in because you love what you're doing, you love the research, you love the understanding of the body, you love what you can do to help the body in whatever way that is. You want to help people. I feel like I hope that most people come into this place to be of service, right? And what you find a lot specifically in the conventional world is we start to get blinders, right? And so I don't want to look outside. I don't want to know what else there is. And if there is more, it's I don't want to learn more. I'm going to treat the way that I treat. This is what I know, and I'm going to stay in my lane because, of course, we know that the brain's not connected to the gut, and everything else, right? Everything's connected to each other, and we lack this holistic approach, which is why functional, holistic, naturopathic, right, is such a great addition to, right? I don't ever want to sit here and say that there's not an amazing place for conventional medicine, right? Acute care, of course, is huge. But we have to, in my mind, as people who are curious, there's more, and we have to be okay with being wrong. Okay, now we have some new information. This is wrong, and now this is right, and we have to be able to move beyond. I was wrong. Let's now do it right, and it's a hard thing for people to do.
Or we're educated with false or bad information or poor statistics. I mean, there's so many things. Look at like women's hormone now. It's thought to be way safer. And look, you took some of the brightest minds, scientifically driven, open-minded people that went into medicine, and the training is long and the Kool-Aid is strong, and they got these blinders on, and it's actually a personality change. And what happened to these people?
Yeah. What I would love, if you're okay with it, I know that this isn't what you came on for necessarily, but I would love for you to hit on women's hormones, even if you're open to a little bit of, estrogen, progesterone, potentially bioidentical
absolutely.
With breast cancer, and because there's so much fear around hormones and cancer.
Yep, and that fear is irrational. It was placed upon us by this Women's Health Initiative study, which was a waste of money. It was, the statistics were wrong, or interpreted wrongly, and a lot of the cancers, female cancers, were driven by what are called conjugated or synthetic hormones that were given to us. Some of them are based on horse urine. Premarin is called, from pregnant mares.
Yep.
And then also, some of these other progestins and things. They were fake, and they caused issues. Bioidentical means you're getting a replacement of the actual hormone your body makes. Your body can't tell if you made it or someone else made it, or it's made in a lab. Bioidentical, it's biologically the same. And we do not see the types of risks for cancer. In fact, what we see is the opposite, that disease progression, cardiovascular disease, dementia, loss of bone density, things like that are all improved if you are able to start early and often with proper guided bioidentical hormone replacement. And it does not have the same risks that you were probably advised. Sadly, a lot of Kool-Aid drinking doctors still won't start someone, and it's never too late to start, but start early if you can.
Are you okay with talking specifically about the BRCA2 genes? Because this is something that I've had multiple people come to me. I'm not a doctor. I would love for you to give your information, your insight on that gene specifically with bioidentical hormones.
I don't know of any studies where I can speak scientifically to that, where they took BRCA positive people and hormone replacement, bioidentical hormone replacement, and looked at a risk factor. So I think that's a study that needs to be done.
Yeah.
I don't know that it's out there, but here's something people should think about. It was thought that estrogen and progesterone drives these tumors, and I don't think that's the case until the very late stage.
Okay.
What we think is those cells want and need and expect estrogen and progesterone. All your breast cells do. And when it gets depleted through the menopausal process, those cells get hungrier and they start upregulating receptors, and they start to find a growth survival advantage. That's where tumors happen. And then when they get too far down the stage, then estrogen might feed them once they're formed. But I think you prevent them conceptually by keeping the normal hormones going. Let's think about this logically. Surging estrogen, if that was the cause of cancer, we'd see spikes in cancer in pregnant women and young women, but we don't.
That makes so much sense.
So let's use logic.
Right.
Right? Yeah, let's use logic.
I love it. Thank you for that. I'm really grateful that you're willing to hit on that for me. Okay, let's dig into stem cells, what they are, what that means, and how you utilize them in practice.
Sure. And thank you for the open question. I mean, I can go on, but listen, stem cells, what's a stem cell? A stem cell is sort of a master blueprint cell from which all other cells stem. They come from. And when you are, a twinkle in your mother's and father's eye, and then a single cell fertilized egg, you're a very potent stem cell. And then you form a multi-cell, you divide into a multi-cell spherical embryo. Those are called omnipotent, stem cell. Those stem cells can form a person. They're so powerful. They are not held back. They can just make a person. Then the embryo starts to form, it flattens out, then it curves, then it starts to look like that, early fetus, like a lizard-looking thing, and it's, then some of those stem cells sort of specialize a bit, and they become not as powerful, they become pluripotent. So there are many kinds of stem cells, and a pluripotent stem cell might form a limb. And this is important when we work towards being able to regenerate fingers and limbs and things down the road. And then as we grow and develop, then you look like a fetus that's a baby. And then a lot of the stem cells, after they're sort of finally in their bone or muscle or organs or wherever they are, they're called multipotent. They can do a lot of things, but they can't make a person. Okay. So they've sort of differentiated or become a little more specialized, even though they haven't been fully given their final job. And then as we are born and we grow and develop, we use those stem cells to do that. We use them to heal and repair and replace. Even as adults, we use our stem cells. And most of them are in our bone marrow, but some are in our fat and other places in our body. And here's the problem. Over time, we get exposed to the yuck in the world. And that yuck is oxidative to our cells. It's inflammatory on a chronic basis to our cells. And as you accumulate this junk, whether it's from stuff in our water, our food, or stuff we should have eaten that we haven't, or exercise we haven't done, or what have you, electromagnetic fields, bad thoughts, and we could go on and on about what makes our
yeah.
So that actually our stem cells are exposed to that same stuff, so they don't work as well. And they get exhausted, and they can only do so much. And at a point, they can't repair us at the pace and efficiency that they could when we were 3 years old. So think about a 3-year-old child skins his knee on the sidewalk. Mom, cleans it up with some Bactine, puts a Band-Aid on it, kisses him, sends him on his way. 3 days later in the bathtub, the Band-Aid comes off, and the scab is almost completely healed. Yeah. Whereas you take a 55-year-old and you bang your elbow on the table and you have a bruise for 2 weeks. Mm-hmm. So that 55-year-old used to be 3. The genes are the same, but they don't heal as fast. So what's going on? The stem cells just aren't able to do what they used to. So the entire basis of regenerative stem cell medicine is tapping back into that youthful, more active sources of growth factors and cell signaling vesicles called exosomes to strategically help fix something that we can't fix on our own.
So are you saying, and I know we'll get into exosomes in a minute, but is it like best practice to use them together, or is that part of a strategic plan, is figuring that piece of it out?
Well, it's figuring it out.
Okay.
And so what we've learned is that stem cells actually don't do the work. If we gave you stem cells, they'd be out of your body in 10 to 14 days, but the benefits last beyond that. Well, what's happening? If the cells are gone, what's happening? Well, those cells have imparted encouragement to our own cells. Our own cells do the healing. They just need to be reminded how to do it.
Okay.
And they do it through the secretion of growth factors, peptides, proteins, and these extracellular vesicles that are about 1,000 times smaller than a cell. So we call them nanoparticles sometimes, but exosomes is the buzzword. And those exosomes are a little bubble, a little bit of membrane, some microRNAs, and some growth factors, peptides, and things. These are some of the same peptides that you make when you do hormesis. What's hormesis? It's a little bit of a stress on your body to build resilience, like hot sauna, cold plunges, fasting, high intensity exercise. All of those cause you to release stem cells. All of those cause you to release heat shock proteins and these survival proteins. So anyway, they come in these stem cell derived exosomes, and those exosomes are taken up by our cells, and our cells then can go from lazy, I call it wartime. Wartime means they're busy fighting off inflammation in the world. They're making machinery for war. And these exosomes come in and flip the factory from wartime to peacetime. And they make anti-inflammatory sets of proteins and activities within a cell. And that cell can then function as it was originally designed in a more youthful, restorative state, its optimal state. So for example, I do a lot of spine and joint work with these exosomes, and we go to the cells that make cartilage. We want to replace cartilage, so we re-stimulate those cells to do what they're supposed to do, make cartilage again. So that's how it works.
So people with arthritis, or people that you would work with, what about rheumatoid arthritis?
Yep, all of the above. Anything that degenerates the joints. So this is the process of osteoarthritis that sometimes gets dummied down to the word arthritis by doctors who don't take the time to explain what's going on. Osteoarthritis, rheumatoid arthritis is a genetic increase, in an autoimmune situation. There are a couple ways to approach it. It could be some of these osteoarthritis can be from wear and tear, chronic repetitive use, specific injuries. People have had arthroscopic surgeries, let's say trim a meniscus in the knee, have accelerated osteoarthritis. It helps for the moment, but it does cause some acceleration.
Well, it just makes sense, yeah.
And of course, these people are told they're bone on bone and they need a joint replacement at some point, because on the orthopedic menu, that's next. Well, we're trying to insert something to prevent, delay, dissuade people from needing that joint replacement. And most of my work is now peripheral joints like knees and hips and ankles and shoulders in people who are, can't play pickleball anymore, and they're affected. They're taking too many steroid injections, which have a downside. And we have some amazing results with using the exosomes in a single injection into the cells that make the cartilage. And we have some before and after MRIs showing some cartilage replacement. Now the FDA has not yet approved those marketing claims, so I can't claim that I'm curing or treating osteoarthritis, but I can show you examples, I can show you medical literature, and we're doing more and more of it.
Cool. Will you talk a little bit about the downside of steroids, because I think they're everywhere, the steroid injections. Yeah.
So steroids are incredibly effective at reducing acute inflammation that's causing pain. So they're very, very frequently used for joint injections, and they do help with the pain usually, and not always, and they can be used repeatedly. The problem is it actually accelerates with repeated use the wearing down of the cartilage surfaces. It actually impairs the cells that make the cartilage in the long run. It might help in the short run, hurts in the long run. Plus, if you get systemic uptake in your body, you're actually aging faster with these types of steroids. So if you're on steroids chronically, like an inhaler for asthma, or pills for something. I mean, it might work in the short run, but it'd be great if you could find an alternative because it is aging you faster.
Yeah. Interesting, super interesting point. And so, I think on your website you have lifestyle as an amplifier or a limiter, right? This would kind of go along those lines. As if you're doing chronic steroids, I would, of course, go into nutrition and sleep, and like the things you said a few minutes ago, these lifestyle factors that can really inhibit what you're trying to do. But also, if you're, trying to do the right things to the best of your ability, right? Nobody's perfect, but these are the things that can really amplify what you're doing in practice.
Oh, and we always start with that. You don't come and see me and just, okay, here's your exosomes. We're going to help. No. We get better results if we really tune people up A to Z. So sleep, diet, nutrition, supplements, hormone replacement is a big driver of osteoarthritis and joint pain. So, exercise, we might modify how you exercise or what you do. All kinds of, like you said, lifestyle, what we call epigenetic things. It's amazing that these choices we make on a day-to-day basis affect what genes our cells are calling upon. That's called epigenetics.
Epigenetics is my favorite thing in the world, I think. I think, one of the things that I just love to say is this is where our power is. And for me too, it's God's gift of free will, right? It's the choices we make are our outcomes. And it's just as simple as that. It's not always simple, but it's pretty simple. So yes, I think epigenetics is sort of the key to so many things. If we have the awareness, which many of us do these days, and it's getting better and better, that instead of always having McDonald's, maybe I have McDonald's, once a month, if that's a choice we want to make. I was with my dad last week, and I was really hungry. I was traveling, to go see him. He's like, "There's McDonald's." I went, "I think I'd rather starve, but thank you."
Well, listen, I hear they may move to the beef tallow to make the fries, which are going to make them pretty irresistible.
It's true. It's true. I mean, that's the way they used to make it, right? Was with beef tallow. Yeah. French fries are. Oh, I love French fries. They're so good. Okay. So let's talk a little bit about. Well, we already talked about that. I was going to talk about root cause versus treating the symptoms, but I think that it would be great for you to expand on that a little bit, because that's what I talk about all the time, is let's actually understand what's going on and why, instead of just, doing the steroids. And maybe it's necessary acutely for a period of time, but we can't do it chronically, right? And so what do you see in practice that is really digging into the why behind why you're seeing people in the first place?
And because they've been given the same advice by physicians for decades and decades, which is, hey, you've got wear and tear, you're bone on bone. And when you look closer, I mean, some of the orthopedic doctors aren't even doing MRIs. They're just looking at an X-ray. X-ray is not showing you the cartilage surfaces. It's only showing you the bone. When we do a detailed, high-quality MRI, and I'm very particular about that, we can see a lot more. We can see the changes in the cells that make the cartilage, and those are my targets. So we do some high-end targeting. This is a very precise and specific approach that we take. And this isn't a new approach. What I'm doing has been perfected in Europe. They have over 15-year follow-up with joint work that shows great results if done this particular way. We are going a step further, enhancing how we target it, how we image it, and how I approach it. The exosomes are newer, right? They only had stem cells, 15, 20 years ago when they started that study. We now know that the exosomes are doing the work of the stem cells, and you don't need the cells. You can go right to the business end of the stem cells. We like the exosomes because it travels better in tissue. It is less expensive, making it potentially available to many people, and it's just it's the best and most efficient.
Recording stopped.
Oh. I don't know if that was your note taker. I'm not sure, but.
Sorry.
No,
recording.
okay.
I hope we're recording. But in any event, the most efficient way to approach things, I feel, is the exosomes. We source them from labs through American Tissue Bank Donor Services. These are non-COVID vaccinated mothers who are about to have a C-section. And they're
Interesting.
screened, they're tested, they're not drinkers, drug users, or have any diseases. They don't smoke. They're on prenatal vitamins during their pregnancy. They're totally screened for disease, and then the at the time of the delivery, the C-section, they have, I think, 60 seconds to suction in a sterile way the amniotic fluid, and that fluid is rich in stem cells and exosomes and growth factors.
Mm-hmm.
And it goes to a lab, it's filtered, the cells are filtered out, it's tested and screened for every virus. When we buy a vial of this fresh frozen amniotic fluid, it comes with 4 pages of testing. So I buy it, we stock it here. I have a minus 30 centigrade freezer here in my Las Vegas, Nevada clinic. And people, that I meet, most of my patients come from somewhere else. We meet them by video, we do all the workup remotely. We only invite them here if they're a candidate, Yeah. So not everyone's a candidate. Then we thaw them out right when we use them, and they're basically day zero. They went from the womb to ice to freezer to my freezer to the patient. So day zero, fresh out, the unadulterated, uninflamed, best source of material, safe, ethically, morally, all that.
Mm-hmm.
So all these myths of baby harvesting and fetus stuff is ridiculous.
Mm-hmm. Yeah. So is this all of this? So where you're getting your exosomes? I guess I don't know how many companies there are that produce exosomes. So is this a specific company you use, or is this across the board?
There are many now. These labs are springing up, and there are differences you have to vet.
Okay.
So one, you got to make sure it's from a non-COVID vaccinated source, because we don't know
big deal.
that do.
Yeah.
Two, I like fresh frozen.
Mm-hmm.
Some places heat it and dry it into a powder, or freeze it into a powder form. Then you have to add fluid to make it back up.
Mm-hmm.
I think you lose some of the growth factors when you do that. You lose some of the exosomes when you do that. So I like it fresh from the womb, unchanged. Some of the companies throw the stem cells into a big, we call it like an incubator or a big flask, and they have these cells pumping out exosome type fluid. We call it secretome. So I don't use those currently. They're probably okay, but those cells, we don't know if that's their happy environment. We don't know if that's a stressed environment. Maybe their exosomes contain stress proteins, and so we don't know that. So even though we've seen some benefits in some use cases for that, I still like the fresh from the womb. Nature made this stuff, and it seems to work great.
That's amazing. Very cool. Good to know. I might be backing up just a little bit, but in my notes here, I have activation, deployment, integration. So is this sort of your system of how you do things?
Well, I always call, since the stem cells, through their exosomes and growth factors, aren't doing, stem cells aren't doing the work, it's the signaling, and our cells do the work. I call that activation.
Gotcha. And
we do integrate that. I think when we talk about integration, we're talking about all of the other anti-inflammatory, epigenetic, lifestyle choices or treatments that can enhance. And in the last couple of years, peptides have been probably a big game changer for a lot of these things. So we're using strategic small proteins called peptides for people, whether it's a joint problem or other issue, to help influence their health from an alternative perspective.
Awesome. That leads me to, I need to take a break. We're not going anywhere. But I do have a sponsor that I need to make sure that I bring up, because sometimes I just get to talking and I don't talk about my sponsor, which is probably not a nice thing to do. And I don't have her graphic up, sorry. But Susan Drake is with Mountain Medical Concepts, and she's a good friend. She represents a company. Do you know New BioAge? Do you know New BioAge?
I do, yeah.
Yeah. So she represents New BioAge, a great company when it comes to specific supplements and peptides and that kind of thing. And she's great. The company's great. They've got really high quality products. She also does some other things. I think that I'm not sure, we've not talked a lot about the exosomes that she represents, but she does some exosomes. She does some food sensitivity testing, other types of, pretty specific kind of functional lab testing. So she's great. I appreciate her a ton. Since I don't have her graphic up, I tend to run late always, so I don't have her, but she's always in all of the promo materials, everything that we're doing, because she's such a great resource and she is great for practitioners. If you're not a practitioner and these are things that you're looking into, reach out to your doctor, reach out to people like Dr. Jeff, who are doing these things and making sure that the quality is top notch, right? You want to make sure that what you're doing, what you're putting in your body, what you're spending your money on, all of these things are the best of the best, and bringing good health to you, and of course to your family, and epigenetically to your future. So big to all of our futures, right? It's a big deal. So grateful that she is our sponsor. All right, now we can move on. So very good. So I have here also NK cells. Are those natural killer cells?
They are.
Mm-hmm.
So we've been speaking generically about stem cell derived exosomes, which have so many anti-inflammatory uses, but we didn't, for a number of years, have anything for cancer patients. And we have been blessed with having access recently, earlier this year actually, to obtaining natural killer cell exosomes that we can help as an augmentative or alternative approach for patients with cancer.
Amazing. So for all types of cancer?
So far, yes. The research is robust in this area. We use them both intravenous and in direct injection into tumors in accordance with the research. So there are all kinds of great studies showing how the natural killer cells, which is part of our immune system, right? A very small percentage of our white cells are these natural killer cells whose job is to go around our body during our life like a security system and remove abnormal cells, parasitic infected cells, other infected cells, accidental cancer cells that we do make during our life, and even senescent zombie cells get removed. And they do so by specific exosomes made by the natural killer cells. So the natural killer cell exosomes contain some enzymes that go into the abnormal cells selectively. They do not go into normal cells. And they go into these bad cells and tumor cells, causing those cells to lyse or open or rupture, making them useless. Then we recycle the contents. So we have access to those. They were very difficult to get from Europe because the natural killer cells are such a small percentage of a system. And then to get enough of those together and actually have them, boost the exosomes is challenging, but we have them.
So I think that most people know what cancer cells are, unfortunately, but what about the senescent and or zombie cells? I love that they're called zombie cells, and we had that in the title. It was like, it's so funny to me, but yeah, let's talk about those.
Yeah, so senescent zombie cells are cells in our body that were useful at one point, but they divided too many times, they're done dividing, then they get bloated, big, and boggy, and they leak pro-inflammatory junk. They're basically that uncle that comes over and won't leave. He's eating all your food, taking up your resources, not contributing. And so these senescent cells, the more that you accumulate, the effectively older you are internally. Because senescent means senes means older, like senile. So these are the cells, you don't want them. You want a younger cell population in general. So you can get rid of some of your senescent cells by fasting. Do a 3-day fast, helps clear them out. Other hormesis type activities, or you can enhance the natural killer cell system, and there are some supplements that do that. Glutathione, although it's difficult to absorb glutathione, is one of them. Transfer factor is another one that we like. And these activities of the natural killer cells have been shown in a study to reduce senescent cell markers, meaning age markers, in people for up to 2 years, a single infusion
Wow.
for up to 2 years. So the marker, for those of you at home that want to look this up, it's beta-galactosidase. Beta-galactosidase is an enzyme that's leaking out of these senescent cells. So the more beta-galactosidase you have, the older you are internally because of these cells.
Well, we can test that, right?
We absolutely can.
Yeah. It says smart. I have not tested it. Now I want to. Cool. So let's talk a little bit about cost, which is not fun to talk about.
Yeah.
But I think it's
No,
important. Yeah, because a lot of these things, they, the FDA doesn't like them, the insurance companies don't like them. There are a lot of cash, and people are like, oh, it's just too much for me. Well, how are you not getting around, but how are you managing that?
Let me tweak a couple of those, the prologue to your sentence there, because first, the FDA hasn't said they don't like them.
Okay.
The FDA has not yet evaluated them.
Okay.
That's neutral. I don't know why that's taken as a negative. They just haven't. Big Pharma doesn't want them to look at these things.
Right.
So the FDA is neutral. They have not yet evaluated the claims. And remember, the FDA only evaluates marketing claims. They do not approve, when we use the word approve, what doctors do, what patients receive. That's a sacred relationship between a doctor and a patient through informed consent. So another myth that's out there and misused, often that word approve means for marketing claims. Okay. The second part of the sentence I wanted to comment on was insurance companies. They are starting now to pay for low-level regenerative medicine. Okay. We have finally seen them start to pay for platelet-rich plasma, or PRP, which is really the lowest potency coming from your own blood offering. They've seen that as cheaper than paying for a knee surgery, for example, or an elbow surgery.
Sure.
So there's a move afoot where the bean counters are actually paying attention a little bit to the money, since that's the bottom line is they want to make a profit.
Right.
So how do we approach this? Well, luckily, exosomes have brought the cost down significantly. I know you can go to Panama for stem cells, and it's going to cost you $25,000, but you get a vacation out of it. Here in the U.S., it depends on what we're doing. Like if we do a single knee and everything's dose dependent, 2 doses, you might be looking at $8,500 all in. So gosh, if you're facing a knee surgery, downtime, physical therapy, pain, risks you have to face, complications, $8,500 one-time injection is not too bad. Yeah,
agreed. I have a client who came to me, so ulcerative colitis, but before that, and she young runner, but was having severe hip pain and hip issues, and was told not to do stem cells, that it wouldn't work, and it changed her life. And so it's amazing when people have the ability to think outside the box and go, I'm going to try this anyway. Because so often, if we don't listen to the people who are telling us this is what we should do, then we're fired as patients, right? So, yeah. So anyway, and she was fired as a patient, but that's okay because she is much better now.
How rude is that, right? And I've had patients that have seen me for an opinion and gone back to the orthopedic doctor. Oh, the orthopedic says that's illegal. It's not proven. Well, I can show you the medical evidence that proves it. Just because you don't want to read it, or you haven't gone back and relearned it, doesn't mean it's not proven. It's just not proven to you, sir.
Right. It's true. It's true. Again, going back to just wearing your blinders, which is not a fun place to be as far as I'm concerned. Anyway, I always want to learn new stuff.
Right.
Okay, so I think probably the best last question, is this our last question? I mean, not really, we still have some time, but what are you seeing? So we talked a lot about what is now, this is kind of like the future of medicine, but it's the future that's now here, right? It's being used well, and it's working well, especially, if we're looking at cancer, which is such a scary place to be, and we feel hopeless, which is heartbreaking, and this is the stuff that gives hope, right? And so what are you seeing as far as what are things to come? Do you have any thoughts on that?
Absolutely, I do. I wasn't going to
Good.
hold back on you here, but I don't think regenerative medicine is the future of medicine. I think it's the present. And if you don't look at it as an alternative option, at least look into it, then you're receiving care from the past. The future are there are advanced things that are coming. I spoke earlier about finger or limb replacement with pluripotent cells. We now have the ability to reverse cells into a pluripotent state. We have other types of exosomes better for the brain that are specific from nervous system stem cells, which are more specific. We're looking at endodermal, which is a different type of embryonic layer exosomes for disc, and something called Muse cells. And these are very small subset of stem cells that produce exosomes also that have even more potential based on their cargo. So those are what's coming, and we will have them. I'll probably one of the first clinics. I'm chasing these all the time for new approaches, enhanced with peptides, and then down the line, designer exosomes. Maybe be precise based on a person's need, what growth factors, what peptides are in there, what microRNAs. We can do that. It's coming.
Yeah. Let's talk about the neural exosomes for a minute, because on top of the cancers that we're all struggling with, or so many people are struggling with, we have the dementia and the Alzheimer's, and that kind of goes back a little bit to the hormones. We start losing our hormones. Estrogen's neuroprotective for women. We don't have our hormones. What's going to happen, right? We start to lose our cognitive abilities. It's scary. Men, testosterone is neuroprotective. And if men start, aromatizing their testosterone into estrogen, then what's going to happen? They're going to be sad and defeated and frustrated and unmotivated, and all of these things that can happen in this, sort of andropause situation. But the end of that is that we have to protect that neurological health. And so, what are the exosomes doing for something like this?
Well, the generic stem cell exosomes, the ones we have now from amniotic fluid, we use actually delivered IV or nasal spray. There's a great pathway at the back of the nasal cavity that can sneak those into the brain, and exosomes will cross the blood-brain barrier. They're small enough. Cells won't. Okay. So another reason we like the exosomes. Yep. And we're seeing anything that has an inflammatory role, like MS. Alzheimer's disease has an inflammatory component because you make these misfolded proteins, and there's an immune response, an inflammatory response. Things like this, we've seen some benefits. I think we're going to do even better when we get the neural-specific neural stem cell exosomes. There's even some work in China. A lot of cutting-edge things come out of China. They're very open-minded with what they try over there. Where they've actually had some improvement in spinal cord injuries. And so we're doing all kinds of things. They've also pushed the envelope on disc regeneration in the spine, which is always a challenge because it's made of two different types of cartilage. Okay. One of them being of a different embryonic origin. They've used the Muse cells I referenced for that, and we see ourselves doing that in short order here.
Awesome. What about heart health? So the things I'm thinking specifically, the cardiomyopathies, the heart failure, the congestive heart failure, the valves that are not functioning well, all of those things.
I don't see stem cells fixing structurally deficient valves at this point, but I'm open-minded. We'll see what we can come up with. But for heart function, the myopathies, the heart failure, we do see that regenerative approaches, stem cell exosomes, have been beneficial, both intravenous, and also I have a colleague that actually does a little injection and layers it, he goes right between the front ribs here, and just drops some on the membrane around the heart, he doesn't put it in the membrane or on the heart, but he has had benefit in function, in output, cardiac output, for patients who may not have been a surgical candidate, and he helps get them into the candidacy where they can then get a more formal treatment. So the heart is a great target. Also, interestingly, one of the reasons I don't love stem cells for intravenous use is the heart and lung suck up most of them.
Okay.
Cells are big and sticky, and
Mm-hmm.
because in the vein they go to the heart first, then the lungs, then back to the heart. It's like locations 1, 2, and 3 get all the delivery.
Yep. Yep.
So, however, if you're recovering from a heart attack or you have a cardiomyopathy or some type of heart failure, that stem cells might have an advantage over the exosomes.
Interesting. So I'm going to ask another sort of off question. As we're talking, I think of clients or patients I've had. One is he had that membrane removed, right? It kept getting inflamed and they just took it off.
Yep.
And so it didn't help any of his problems, which is obviously really frustrating for him. What about something like that? So your colleague who's injecting around the heart, would that be something that could be protective?
So it doesn't have a pericardium.
Right.
I don't know if he would still inject around the heart or just do it intravenous.
Yeah.
We would. I bring in, subject experts when it's outside my scope or
Sure.
I'm not willing to inject inside the chest.
Yeah.
So that wasn't part of my career. I would involve him in a case like that, but I'm going to refer you to him.
Yeah. Okay, interesting. Yeah, it's always so interesting to, it's just these people just always are popping up in my head, these questions that, like, I don't know anything about the pericardium, so I'm going to ask you, when it's be removed.
Well, I was amazed that he just puts it on top of the pericardium and gets those results. I'm like, wow. And he gave a whole presentation. We have a little group of us that do exosomes in the country. We call it the Therapeutic Regenerative Exosome Group, or T-Rex, because we think that's cute.
It is cute.
So we're T-Rex, and he gave us a presentation. It was just wowed me. Yeah.
So I'm a part of a functional medicine grand rounds group, and we should have you speak to us as well. That would be super cool if that's something that you're interested in.
I would love it.
Yeah, awesome.
I would love it.
Cool. All right. I want to make sure that if there's anything that you want to talk about that you think is anything you want to talk about, that we make sure that we hit it. I don't care what it is.
Yeah.
Before we finish.
Wait, everything I said was super important. What do you mean?
Yeah.
I think I can add one more thing here. We find exosomes in nature. We find that you can get exosomes from bone broth, bone marrow, because it comes from the marrow where a lot of the stem cells are, so you get tons of exosomes.
Oh.
Why do grandmothers in most cultures make you chicken soup when you're ill? Because it has exosomes from the chicken stock, from the bone marrow of the chicken bones. We also find it in colostrum in milk, and lastly, a little bit different, but we find that plants have stem cells that make exosomes, and that's how plants deliver their phytonutrients. I know you know what that means, of course, but for those of you who don't like those big words, that's sort of the specific biochemicals plants make that our cells love to flourish upon. And let's list a few just for funsies: resveratrol, quercetin, fisetin, glutathione, spermidine, berberine, vitamin B's, vitamin C. All of these things are made in plant exosomes. The funny thing about the nutraceutical industry is they take the plants, they mush them up, make the liquid, then they make it into a powder. They've opened up the exosomes. So when you take that nutrient, you lose some by digestion, then it gets into your bloodstream some, and then you lose some there. It doesn't get into your cells with high efficiency. But nature figured this out. And nature makes this exosome that delivers to our cell at 700 to 4,500x more concentration of phytonutrients. So why haven't we tapped into that? Well, you couldn't eat enough fruit in a day however, we now have, I've sourced a lab in Italy, and in May, we launched a plant-derived exosome nutraceutical. We got organic curated Italian fruits in the blue Mediterranean, anti-aging, live long zone. We've got different citrus fruits. We've got mango and papaya, and this lab will extract the exosomes at significant cost, might I add.
I'm sure.
We now have a single capsule you can take, and if you take this, you don't need resveratrol, quercetin, fisetin, a bunch of others. And the preclinical studies show increase in sirtuin-1 gene activity. And for those of you at home that don't know what that means, it's a mitochondrial gene that's associated with anti-aging. It's why you take resveratrol, for example. And then decreased reactive oxygen species, meaning decreased cellular inflammation, cellular stress. So those are age-related markers at the cellular level. So we take one capsule a day. You could probably get rid of 5 or 6 or 7 other supplements you may be taking. And this is our baby, our new project. We call it Longevex for longevity exosomes.
Keep me posted on that. I love
Yep.
that. I love what you're doing. And I agree. I think that, supplements have a place. Therapeutically, they have a place. But we spend so much money on supplements, right? And I'm always trying to kind of bring that back a little bit. Let's try not to do that. And then take the things that are super beneficial. Yeah.
It's, listen, it's like religion.
Yeah.
Some people pray just in case. Well, I take a lot of supplements just in case. We don't know if it's getting into our cell or not. But I love this exosome concept. And this is just our first product. We're going to work on a highly anti-inflammatory one, based on curcumin and some other ingredients. The lab's trying to extract the exosomes now. So we just see this as a high efficiency, high concentration, intracellular delivery where you can need it.
Yeah, very cool. I have one last question for you. Going back to the bone broth, I make bone broth all the time, and I use marrow bones and the chicken bones and the chicken feet and the whole thing, right? But obviously, I heat it and I cook it for days. So is that not damaging to exosomes?
Yeah, you're losing some. You are losing some, but I don't think you want it uncooked. So I mean,
right.
So there are limitations in everything, right? It's not going to cure your osteoarthritis, but it will help your cellular function at some level.
Okay, got it. Cool. Thank you.
Sure.
Yeah, this is really good. I appreciate it so much. I would love to have you on again. I'm gonna have you on in my little functional medicine grand rounds group. I'll talk to them about that too. I think that would be super fun if whenever you have a little extra time, and I know you're not busy at all.
Well, I love educating, because we have to let people know that these are available. These are options. You don't have to be stuck in the sick care system, the cookbook system. So, seek alternatives, ask the questions. Doesn't hurt to talk.
Awesome. All right. We didn't talk about the name of your company. So how do people find you?
Oh yeah, we're Recelebrate, because we're celebrating the renewal of your cells. That's spelled RECELLEBRATE, and I think we've cornered the internet on that word because we made it up. So if you search that word, you'll find our website is recelebrate.com, our Instagram, our Facebook, LinkedIn, everything is Recelebrate.
Cool. We've got it all over everything as well. So you'll find Jeff's information as well as his clinic information, and then the Recelebrate and all of the amazing things that you're doing. I'm grateful for all of the good things that you're doing. People need it. People need the goodness, and they need people who are excited and looking outside of the box and willing to help. So thank you for your service.
Thank you so much. I appreciate it. It's been my pleasure.
Cool. Very good. All right, everybody. You will find us here every Thursday, 10 a.m. Mountain Time, streaming live on KUHSdenver.com. Then, of course, on all of the other social places, and then uploaded as the podcast. So you'll find Dr. Jeff with us here next week. On the podcast next week when we get it uploaded, just to be clear. And then you can find me, Taste Life Nutrition, on all of the socials. You can also, I didn't talk about this much, but the new program that's been super fun, where we're incorporating your epigenetic makeup, your lifestyle, all of your labs, all of these things into creating a super targeted report based on you. I've made it where it's really approachable, to get something that's really interesting, that helps you understand what you can do today for yourself, and then for the rest of your days, to be supportive and optimal in so many ways. So feel free to text Blueprint to, what's my number? 720-864-1699. We'll get that to you. Yeah, we'll see you next week. Again, 10 a.m. Mountain Time, streaming live here on KUHSdenver.com. Thank you again, Jeff. Appreciate you so much. We'll have you on again.
We'll love it. Thank you.
Okay. Thank you. See you later.